In this video, we will discuss about rickets. What is rickets? It is a disorder which is seen during childhood. It is a disorder in growing bone. Let's discuss about rickets. The word rickets meaning bone are twisted. How we will define rickets? Disease of growing bones. This one does not seen in adult due to defective mineralization of bone matrix. Defective mineralization of bone matrix at the growth plate in children before fusion of epiphysis. So, what is pathophysiology disorders? There is a defective mineralization of the bone matrix at growth plate. Okay, there is a defective mineralization of bone matrix at growth plate. As a result of this, what happened? The growth plate cartilage and osteoid continue to expand. So, cartilage and osteoid continue to expand, but inadequate minerals. Okay, mineralization is inadequate. As a result of that, what will happen if the bone don't get minerals? The bone become very soft. So bony deformities can be there. Even fracture can be there. Bone width also increase. Bone width increases at a growth plate and distal end of metaphysis. Distal end of metaphysis. Because of that, we have result like wrist widening and other deformities of rickets. That is pathophysiology that happen in rickets. Etiology of rickets in children. Most common causes rickets in nutritional deficiency of vitamin D. On etiological basics, we have divided rickets into nutritional rickets and refractory rickets. Nutritional rickets, it can be due to either vitamin D deficiency, calcium deficiency or phosphate deficiency. This one mainly due to diet. Vitamin D have lot of underlying causes. It can be due to congenital deficiency that below because low store in mother also loss, so mother milk containing less amount. Second one is inadequate dietary intake. Third one is malabsorption, taking proper diet but not absorbed properly due to some other reason. Then any liver or kidney diseases. What is refractory rickets? It is very difficult to treat. It does not respond to usual treatment that we give for nutritional treatment. So rickets that does not respond to usual treatment of nutritional rickets. That means even after giving adequate dose of calcium, phosphate, vitamins, we give after X-ray, no radiological healing documented by 4 weeks. Normally, we should be able to see some radiological evidence of healing by 4 weeks in a child nutritional rickets after treatment. It have some categories, 2 types, vitamin D dependent rickets type 1 and 2, type 1 and type 2. Type 1, it can be chronic kidney disease. It increases phosphate level. renal tubular acidosis, loss of bicarbonate or phosphate level. Third one is oncogenesis or tumor induced. Out of this VDDR1 and 2, type 1 and type 2, the hypophosphatemic rickets are more important one. Hypophosphatemic rickets. Next, clinical features of rickets. Some general features of failure to thrive. Then increasing respiratory illness. Increased risk of respiratory infection because softening of rib. It cannot hold properly, that impairs air movement during respiration. Then increases risk of fracture because bone weak. These are the some general features. Other features starting from head and face of that baby. So starting with the head and face, craniotyphus, due to softening of cranial bone, and you have sensation to pressing ping pong ball and releasing on pressing the skull. Then this craniotyphus can also seen in osteogenesis imperfecta, congenital syphilis, hydrocephalus, and prematurity. You can get frontal buzzing and parietal buzzing, then large arterial prantinals, then delayed closure of arterial prantinals, then delayed tension and tendal caries. These are now coming to chest. You can see rachitic rosary due to beading of costochondrial junction. Then horizon sulcus, which is due to pulling of softened rib by diaphragm from during respiration. Next, limb. Wrist widening, genu, varum or vulcum deformities. This one is the genu varum, this one is genu vulcum. Sometimes get wind shift deformities. Here genu varum, here genu vulcum. One leg genu varum, another leg genu vulcum. Then get bowing of tibia, then double malleoli. Here one more malleoli is present because of all the weight, so due to pressure distal part widening. Some other disorder due to hypocalcemia, vitamin D deficiency. Features have tetany, seizures in children, then tracer sign. Next, investigation method by using biochemical or radiological. First one is biochemical analysis. Biochemical analysis in serum calcium level may be normal or low. Serum phosphate level normal. Alkaline phosphate level is high. Then 25 hydroxy vitamin D3 usually low. Normal range more than 20 nanogram per ml. Otherwise another measurement more than 50 millimole per liter. But here deficiency means less than 10 nanogram per ml or less than 30 millimole per liter. Then X-ray radiological technique. X-ray on wrist or knee would be done. Next, treatment for rickets in children. In neonate and infant, there is a dose of vitamin D is recommended along with a dose of calcium also recommended. 2000 international unit vitamin D per day along with 500 mg per day calcium. In this one for neonate and infant. In the case of older children means 3000 to 6000 international unit per day of vitamin D along with 600 to 800 calcium per day. Treatment should be given for minimum period of 3 months followed by maintenance of vitamin D and calcium rich food. Next, type 2 vitamin D dependent rickets. It refers to some autosomal recessive inheritance rickets. It usually manifests during infancy. There are two types, VDDR1, that means vitamin D dependent rickets 1, then vitamin D dependent rickets 2. This one, first type, it is because of deficiency of 1-alpha hydroxylase enzyme. Treatment purpose we are using calcitriol. Second one is VDDR2. It is basically due to end organ resistant to the action of 125 dihydroxy vitamin D3. This one vitamin D3 present but not active. That is here vitamin D resistant rickets. Vitamin D3 is presented but here resistant. Clinical future extract cause not known. Apart from rickets symptoms, these children found high prevalence of alophasia and ectodermal effect, dental abnormalities and skin lesion also seen. Treatment very difficult. Administration of calcium in large doses for prolonged period, but response to treatment not satisfied. So this is all about rickets. Thanks for watching.